Hi, I'm Dr. Shabana and I'm a dental surgeon working in Kuwait. My clinical practice focuses mainly on preventive dentistry and I have special interest in endodontics and pediatric dentistry. Apart from that, I'm involved in clinical research and I have published many papers in various journals. I'm here to present my article which was published in International Journal of Science and Research and it is a clinical case report about the detailed discussion of single tooth replacement. Teeth may be lost due to many different reasons. Dental caries and periodontal disease are the leading causes of tooth loss. The posterior teeth, especially the first molars, often require the replacement of single tooth. But why should we replace our teeth? Or what would be the effect when we have missing teeth? One of the main issues is that eating will become more difficult. When we lose a tooth, we lose some ability to chew food properly because biting forces could be little less and larger food particles will be difficult to digest and consequently digestive system may have to work harder to digest these large food particles which can have a detrimental effect on our overall health. Another essential reason is that when we lose some ability to grind food correctly, we place more stress on the other teeth in order to chew properly. With this added pressure, we often find teeth will wear more quickly and restorations will fracture more often. That's why wear is more obvious in patients who lose their posterior teeth and start to rely on their anterior teeth for grinding, something they were not designed for. Nevertheless, there are different treatment options available for tooth replacement and one must be aware of those options. However, patients' knowledge of different treatment options is very limited. Hence, there is a need to discuss in detail about the various treatment options available for tooth replacement. This paper attempts to describe in detail about the various treatment options available for replacing a missing tooth. In this case report, different options in detail were discussed with patient verbally as well as a comprehensive letter was sent to the patient. The letter described all the treatment options with their advantages and drawbacks, and each procedure was further explained with diagram in a very simplified manner, which was easily understood by the patient. In this case, a 35-year-old female patient came to the dental department to restore her missing space. She wants to restore her missing tooth as well as protect the root-treated teeth adjacent to it. The tooth has been lost more than 10 years ago. She feels that she has been neglecting her teeth in the previous years and wants to really take care of her teeth now. She wanted the most conservative way to treat her missing space. She seems to be motivated now but still has dental phobia. The patient has no significant past medical history. Previous visits to dentist were only for relief of pain. She only brushes once daily, not using any interdental aids or mouthwashes, but has been using whitening toothpaste and has the habit of vigorous toothbrushing as well. These are the clinical pictures of the patient. We can see on the anterior view in occlusion she has the midline diastema. In the left buccal view we see lower right first molar is missing. Then we have a mandibular occlusal view as well showing two missing molars. Intraoral periapical radiographs were taken to assess the periapical region of 4-7 and 4-5 and also the quality of treatment of 4-7. The tooth showed radiographic evidence of good seal and complete obturation of canals and no periapical radiolucency. The diagnostic casts were mounted on a semi-adjustable articulator with a face bow. By the use of lateral intraocclusal records or check bites, a reasonably accurate simulation of jaw movements were possible. With the help of diagnostic casts, various things were evident. That is, the length of the abutment teeth was accurately gauged to determine which preparation design will provide adequate retention and resistance. The patient was given full information and made aware of the treatment options available and the prognosis and limitations of what can be achieved. Various options in detail were discussed with the patient verbally as well as a comprehensive letter was sent to the patient. The letter described all the treatment options with their advantages and drawbacks and each procedure was further explained with diagram in a very simplified manner which was easily understood by the patient. The treatment options were presented to the patient and were summarized as follows: implants, fixed partial denture, resin bond bridge, cantilever bridge, removable partial denture. The fixed options to restore the space was discussed in detail. A resin-bonded bridge consisting of porcelain tooth and a metal wing on the adjacent tooth could be used as a conservative method of restoring the space. The success rate of resin-bonded bridges was discussed in detail. With improvements in the field of adhesive dentistry, resin-bonded bridge work has become a viable option for long-term replacement of missing teeth. A major advantage of resin-bonded prostheses is that minimal tooth preparation is required, and so they can usually be considered a reversible procedure. As dentin preparation is not involved, the integrity of young pulp is maintained. Other advantages include the fact that anesthesia is not normally required. The aesthetic problem was discussed with the patient. The key to solving this problem may be to use tooth-colored materials such as zirconium oxide and fiber-reinforced composite as the framework of the resin-bonded prosthesis. The option of conventional bridge was discussed with the patient. It was explained that although this option has good long-term success rates, but a major shortcoming of this alternative is the significant tooth reduction of the abutments. The lifespan of conventional bridge work is thought to be in the region of 15 to 20 years. Loss of retention and fractures of both teeth and reconstructions in fixed and removable prosthodontics have been shown to be more frequent when the distal abutments are non-vital. As the distal abutment tooth will be non-vital tooth in this case, the shortcomings were clearly explained to the patient. The option of implant placement was discussed with the patient. The implant process was explained and a series of photographs were used to demonstrate the treatment stages and final restoration. The success rate for replacement of a molar or premolar with a dental implant restoration has been shown to be greater than 95%. Many clinicians feel that due to the substantial success rate, implants should be considered as the definitive choice over other tooth replacement alternatives. This is supported by the dental literature for many implant systems in every area of the mouth. The option and limitation of cantilever fixed partial denture was explained in detail to the patient. Technical failures are more common when non-vital teeth are abutments. The option of fabricating a removable partial denture to replace the space was discussed. The nature of the appliance was discussed with the patient using photographs, and it was explained that although the space would be filled, but the appliance would be removable. As the patient was certain that she did not want to undergo any surgical procedure, and she also didn't want any tooth reduction of other two teeth. She wanted to have the most conservative way to treat her missing space and had no problem about the retainers. Patient didn't want anything removable as well. So these points lead to discussion that resin retained bridge was the best choice for her. In this particular case, the patient has good height of the abutments, that's 8 mm and 7 mm, in order to allow a rigid retainer to be made with a large surface area for bonding, so reducing the risk of failure. Moreover, there were no history of parafunction or grinding habits, which may further reduce the risk of failure. So the patient's awareness for different treatment options for missing teeth is one of the most important factors because it helps the patients to have early replacement of missing teeth. Moreover, the timely provision of adequate dental prostheses will help the patients to achieve better quality. The choice between several treatment options for replacing a single missing tooth is influenced by various factors. The final choice depends on several factors which affects the decision making. Among these is cost and patient's awareness of different treatment options. Ultimately, it is the longevity and strength of the teeth that is expected at a financial ease. Please search for the URL if you want to go through the entire case report. Thank you very much.